Hi, my name is Chad Abbott. I'm a transplant coordinator at Michigan Medicine. Along with myself, we have fellow coordinators Kelly Wyatt, Chaz Church, and Deb Zarnata, as well as assisted personnel Rachel Zamet and Angela Johnson. Although the decision to become a living donor involves careful consideration, being a living donor offers recipients an alternative to waiting on the national transplant waiting list for an organ from a deceased donor. In this presentation, I'm going to talk to you about the Living Liver Donor Program at Michigan Medicine, the facts of living liver donation, financial considerations of donation, and the process to become a living donor at Michigan Medicine. This slide shows the number of Michigan residents waiting for a liver transplant. As of 2021, in November, there were 205 people waiting, and the national waiting list as of January of 2022 was 11,750. At Michigan Medicine, we performed 2,700 liver transplants since 1988. Our first liver transplant was done in 1985, and our first living liver donation was done in 1996. This slide shows the number of transplants that we perform. You can see that our deceased donor transplants are generally in the 70 to 80 range. Our living liver donor transplants have been for the past 2 years. So some facts of living liver donation. Fact is that a living liver donor is the best option for most patients who need a liver transplant. Some additional facts. Our requirements for living donors must be between the age of 21 and 55. They need to have a body mass index less than 35, be in good general health, not have any significant mental illness or substance abuse. They must be compatible with their intended recipient. We look at anatomic considerations for both the donor and the recipient, and the donor must have personal health insurance and a primary care physician. Living liver donors do not have to be related to the recipient. Donors can donate to a family member, a friend, or even someone they do not personally know. A complete living liver donor evaluation will be completed prior to donation to ensure the donor's safety. This evaluation will include a complete physical exam with lab work and imaging studies, a psychosocial evaluation, and we also take into account financial considerations for the donor. Donors with increased risk behavior, such as previous drug abuse or jail time, are not automatically excluded from donation. All potential donors are screened for behavior risks that may lead to transmittable diseases. Living liver donation is safe. The donor's safety is always our primary concern. There are more risks involved with liver donation than kidney donation. Most complications that do occur are minor, and the more serious complications can be treated and rarely have any long-term side effects. Overall, living liver donation is a safe option for transplantation. The living liver donor's remaining liver lobe will regenerate or grow back to its full size approximately 8 weeks after surgery. During this time period, we recommend that donors follow a healthy lifestyle, do not drink alcohol, use nicotine, or any illicit substances. Donors will be provided with activity guidelines, including lifting restrictions by their team. Donors do not have to take medication for life, unlike transplant recipients do. A liver donor will be given prescriptions for pain medication and stool softeners at discharge from the hospital during the recovery period only. Donors will have some pain following the surgery from the incisions. The pain will diminish in the days following surgery and can be controlled with pain medication. Soon after surgery, donors are helped out of bed to walk. This is generally the morning following surgery. Before leaving the hospital, donors will be walking independently and performing their activities of daily living. At Michigan Medicine, donors are typically discharged from the hospital 3 to 5 days after surgery. Living liver donors can resume normal physical activities after the initial recovery period. The average recovery time for a donor is 6 to 12 weeks. Donors should be prepared to take the full 12 weeks off for recovery, though, if needed. About 50% of the donors return to work at 4 weeks, 75% return at 8 weeks, and nearly 100% of living donors return to work by 12 weeks. Donors will be told not to lift anything weighing greater than 10 pounds for 8 weeks to decrease the risk of a hernia or other abdominal injury. And donors should not drive until they are cleared by the surgery team, which is generally about 2 weeks after the surgery. Living liver donors are required to follow up with the post-transplant team after donation. A post-operative visit will occur at 7 to 14 days after discharge and again at 30 days after donation. All donors are required to follow with a primary care provider or a transplant surgeon at 90 days, 6 months, 12 months, and then annually following donation. There are no long-term dietary restrictions for a donor following donation. Everyone should eat a healthy, well-balanced diet. Donors will need to abstain from alcohol post-donation for a minimum of 6 months. After that time, alcohol may be consumed in moderation. Living donors can and do have children after donation. At Michigan Medicine, we recommend that donors wait at least 6 months to become pregnant. Living donation does not cause fertility problems for men or women. Potential donors should consult with their OB provider to let them know that they've been a living donor. And we recommend that potential donors discuss a plan with a transplant doctor prior to donation. At Michigan Medicine, all costs of the evaluation, surgery, and any complications are covered by us. Any complications that may occur following donation for the donor's lifetime are also going to be covered by Michigan Medicine. The National Living Donor Assistance Center is a federal agency that provides assistance with expenses related to donation that are not covered by us. These could include travel, lodging, and potentially lost wage reimbursement for the donors. This is an application process that we are able to assist with. The donor safety is always going to be our #1 priority. To be approved as a donor, the transplant committee must believe the donor will not be negatively impacted physically, socially, emotionally, or financially. So some final facts of living liver donation. The operations are planned, allowing time for preparations for surgery and recovery. The wait time is shorter and allows the recipient to receive a transplant before becoming too sick. Livers from living donors are usually of excellent quality because the donors are extensively evaluated prior to donation, and donors are only allowed to donate if they are in very good health. Donation is voluntary. Donors need to contact us to initiate the process of evaluation. Donor confidentiality is always maintained, and donors have the right to opt out at any time. The process to become a living donor. Again, only the donor can contact our office to begin the process. We have multiple ways that they can do so. There's an online form that can be accessed through our QR code. They can contact us at 1-800-333-9013, or they can email us at txp-donors@med.umich.edu. The steps to living liver donation: the donor needs to contact the living donor office. We'll have them complete a questionnaire for screening purposes. And then if they're approved to move forward, they'll go through a formal evaluation at Michigan Medicine. We do have the ability to have donors evaluated at other centers if they live out of state. Once the donor is cleared to donate, then we will move forward with scheduling. The time from referral to donation is variable, and it depends on multiple factors, including the donor workup, as well as where the recipient is in their process. We also have peer mentors that are available to discuss all aspects of their living donation experience. Thank you.